I'm here in Denver at ARVO with Joanna Yao. Joanna, you just showed us a very interesting poster on vitamin D, AMD, hypothyroidism. Can you talk to me about that?
Yeah, so the way that my project first came to be is that we noticed that certain people with dry AMD develop wet AMD, while other people with dry AMD do not develop wet AMD. So we want to understand better if there are systemic comorbidities that a patient might have that can help differentiate between people who will develop and will not develop wet AMD. So with that in mind, we decided to use a US database that has access to electronic health records to determine if we can find systemic comorbidities that can differentiate between those patient populations. So first, we found patients who all had dry AMD, and then we divided them between patients who developed wet AMD within 5 years and did not develop wet AMD within 5 years. Afterwards, we controlled for certain characteristics, including age, gender identity, and also race and ethnicity, and then determine if there are any systemic comorbidities that can help differentiate between the two populations. So with that in mind, our results show that the models were able to differentiate between the patients pretty well. And one thing that consistently showed up was vitamin D deficiency was associated with more patients developing wet AMD than those without vitamin D deficiency. Another one that was also identified in the model was also acquired hypothyroidism. And then there are also certain factors that were considered to be protective, but because our research was focused on whether there were risk factors of leading to more wet AMD progression, we decided to focus on vitamin D deficiency and acquired hypothyroidism. And to help strengthen a more temporal relationship between having the systemic comorbidity and developing wet AMD, we use a Kaplan-Meier curve to show that people with vitamin D deficiency had a median time of conversion from dry to wet AMD of 1.86 years. And patients without vitamin D deficiency did not convert to wet AMD. A similar finding was also found for acquired hypothyroidism. So overall, our findings show that potentially systemic comorbidities that are identified in a primary care physician's office can help stratify patients with dry AMD to identify them as being more increased risk of developing wet AMD. While currently it also supports current literature where recent papers have also showed that vitamin D deficiency may also be related to AMD progression. And the current understanding at this point in time is that vitamin D helps regulate the immune system and also is anti-angiogenesis or prevents the formation of new blood vessels. So potentially having a decreased vitamin D deficiency can upregulate inflammation in the body and also promote new blood vessel formation. Acquired hypothyroidism also has a similar idea where potentially it is also increasing inflammation and also increasing the risk of developing wet AMD.
And the next step is?
So then the next step shows that potentially there are actionable factors where people who have dry AMD and have these systemic comorbidities should be kept closer, have a closer eye on, because potentially they may be at more increased risk of developing wet AMD. Another thing is that it can inform future interventions. We're trying to make sure that patients who do have these systemic comorbidities, again, are kept more aware of and also intervened on more often.
Thank you so much.
Of course. Thank you.